With previous skills in slaughtering animals, 3 small glasses of hard liquor, and a kitchen knife, the patient sliced her abdomen 3 times through the skin, fat, and muscle. Back in 2000, 40-year-old Inez Ramirez Perez was pregnant with her 9th child. Perez lived in an isolated village in the mountains of South Mexico. Her cabin had no electric, running water, or sanitization. Having previously lost a baby due to obstructed labor, she was determined to not let that happen again. As such, when Perez went into labor this time, she took matters into her own hands. After 12 hours without the assistance of another adult, Perez was in so much pain that she couldn't stand it anymore. Speaking with the Sydney Morning Herald, she said, "If my baby was going to die, then I decided I would have to die too. But if he was going to grow up, I was going to see him grow up, and I was going to be with my child. I thought that God would save both our lives." With previous skills in slaughtering animals, 3 small glasses of hard liquor, and a kitchen knife, the patient sliced her abdomen 3 times through the skin, fat, and muscle. She cut across the uterus and in a squatted position. This thankfully pushed her uterus, rather than her intestines, against her abdomen where she made the incision. After an hour of self-operating, she pulled her baby boy out of the bloody wound. Luckily, the baby was able to breathe and cry immediately. Perez did not bleed excessively and was able to ask one of her children to call for a local nurse before she became unconscious. When the nurse arrived, they tucked her bowel loops back inside her body and sutured the skin using an ordinary sewing needle and cotton thread. She was then taken to the nearest hospital over 8 hours away. The surgeons were thankfully able to patch her up and ensured she did not have sepsis or organ injury. After 10 days of triple antibiotic therapy, Perez was discharged from hospital. Before Perez's story, only anecdotes of self-inflicted C-sections had been reported, and none of them detailed cases where both the mother and child survived. This was a rare case that was compounded by the fact that the rural setting where the mother was located was not adequately supplied with healthcare. Perez was also very lucky to not have passed out from the pain, not to have gone into shock or bled to death, and not to have contracted an infection despite having an enormous open wound and living in unsanitary conditions. Although this case had a successful outcome, measures should have been implemented so that people all over the world are offered essential reproductive care.